The unique partnership between Mount Sinai with Data for Life and HPI really can address the challenges that we're facing.
Those challenges in healthcare are demography, technology, and social inequality. The workshop week is to bring people together from Mount Sinai and HPI. The goal of this is to identify new projects for the sake of the patients.
This workshop is really positioned well to help deal with any kind of challenges, and from there, the development of tools and projects that could address our health challenges.
I was hoping from this workshop week to kick off a new project.
As much as possible interactions to get to know people, see how the German market thinks about digital health and data.
Getting inspired by the other.
Because everyone brings their unique expertise.
So imagine you have two players. One player is really strong in technology, the other player is really strong in clinical service. You bring them together as a team. And then you specifically try to find out what kind of technological development will improve disease outcomes.
This workshop is about building trust between people. We asked all our doctoral researchers to join, to present their research and to engage in a dialogue about their work. In this partnership, innovative technology and real-world medical practice come together to drive impactful change. We have a huge medical institution on the one hand, the Mount Sinai Health System, and we have a unique IT and engineering institute here in Potsdam, the Hasso-Plattner Institute.
We see so much interest of especially IT and data science experts at HPI working with real-world data that we have.
The role of Data for Life in this partnership is creating digital solutions that enable making health data available for research. And the AirMS research platform hosts multimodal health data coming from Mount Sinai, and the data is provided to all data science researchers.
I would say young scientists are particularly important for this partnership. They are our cornerstone and our drive in this entire partnership. Not just the PhDs within our graduate school project, but also the younger scientists.
We created a digital platform where we can release any type of digital health studies without never coding. We can integrate wearable devices, but also we can integrate machine learning algorithm or new AI algorithm.
We're seeing AI take on a much larger role in digital health. Artificial intelligence is enabling us to better analyze data and understand complex health trends that are going on, to be able to then translate these tools better to care for our patients.
We want to link multiple data modalities and integrate them to predict epilepsy.
Our project wouldn't exist if it weren't for the partnership. Enrique, she's taking a more genetic approach and I'm taking a more clinical one. And so we would never have joined forces.
It's fabulous, and I think we're really building a bridge across the Atlantic to actually bring a lot of researchers together that would never have that opportunity.
The international nature of the partnership really makes it special. Get to know what research is being done on the other side of the world.
I'm hoping we will make contributions that really would have a global impact.
Yeah, really inspiring to see how over the last 5 years the partnership has evolved, the successes.
The future that I envision is the partnership will grow and the solutions that we are generating will spread much more and more into the Mount Sinai hospital system and from there to the rest of the world.